Hello?
Hi, this is Judy Martin. I'm one of the doctors at Children's Hospital. May I please speak with one of Sarah's parents?
I'm her mom.
My name is Dr. Judy Martin. I'm one of the physicians and a researcher at Children's Hospital. I work in the UTI center where we help to take care of children with urinary tract infections. I spoke with Sarah's doctor, Dr. Smith, and he said that it would be okay if I gave you a call. Would now be a good time to talk?
Yes.
I understand that your daughter Sarah has recently had an infection.
She did. Thank you for calling. I appreciate it. She's doing a lot better.
Good. I'm so glad that she's doing better. So, has she had any urinary tract infections before?
Yes, she has. She's had 3 before.
Oh, Vicki, I'm so sorry to hear that. I hope that she's feeling better today. Once you get a couple doses of the antibiotics in, you usually start to improve quite quickly. Well, so this is a very common problem that young children have, especially girls. And so what we do with the UTI Center is that we try to help families talk about why these infections happen and how to prevent them. And we also do some research studies. Okay, first, let's talk a little bit about urinary tract infections. Why don't you tell me what you know about them?
He feels that it may be related to constipation.
Yes, no, that is a very common reason why young girls have urinary tract infections. There's always bacteria in that area, no matter how well your daughter wipes. And what happens is the urethra is actually very short. And so any bacteria that's in that area can get up and into the bladder. Once it gets into the bladder, then the bacteria can multiply and cause an infection. It's actually the fact that we constantly drink and constantly urinate is why we don't get infections more often. It actually helps just to flush the bacteria out. Sometimes children don't take the time to completely empty their bladders, and that can be the reason that they have a urinary tract infection. Does that sound like something that might be happening with Sarah?
Yes, it does.
Have I answered all the questions that you have about things that we might be able to do to help prevent the next infection with Sarah?
Yes, you have.
Okay, so we've talked about urinary tract infections. Now I would like to talk to you about some of the research studies that we're doing with the UTI Center and urinary tract infection studies.
Yes, please.
What we know is that the antibiotics that we use to treat infections are very safe and they work very well to treat the infections. The standard therapy is usually 10 days of antibiotics, but we know that in adult women we can use anywhere between 1 and 3 days of antibiotics to treat the infection. So what we're trying to figure out is maybe 5 days can be safe and effective instead of the 10 days that we usually use. 5 days of antibiotics might be associated with less side effects. There would be less diarrhea, less chance of a yeast infection, and some kids get rash, so if you have less antibiotics, that might be less likely for that to happen. In addition, we know that use of antibiotics is associated with the development of resistance. What happens is the bacteria can become resistant over time to the antibiotics that we use. So what we're trying to figure out is maybe 5 days of antibiotics might be all that we need to treat the infection. But we want to make sure that everything is safe. So we would only want your daughter Sarah to participate in the study if after 4 or 5 days of antibiotics, she's completely back to normal. If she's doing well, then we would think that it would be safe for her to be in the study. We want to be blind to the treatment, so we can't know if she's getting 5 days of antibiotics or 10 days of antibiotics. And we want you to be blind to that also. What happens is that the children are randomized to get either the 5 days of antibiotics or the 10 days of antibiotics. She takes the first 5 days that you have at home, and then we would meet you, and again, if everything is fine, we would give you a second bottle of medicine. That bottle of medicine would either contain the same exact antibiotic that she's already on, or it would contain a placebo. Placebo is a suspension or a liquid antibiotic that looks and tastes just like her usual antibiotic, but it doesn't contain any active medicine. She would take that medicine for the next 5 days, and then we would see her and see that she's doing well, and we would do a follow-up urine culture to make sure that the infection is completely clear. This, of course, is voluntary. You do not have to do this study. It's something that we're trying to offer families, and it's a way for us to figure out if 5 days of antibiotics might be just as safe, be effective to treat the infection, and be associated with less side effects. Dr. Smith thought that this is something that you might be interested in. Does it sound like something that you might be interested in for Sarah?
Yes, I would like to talk to her when she comes home from school.
So this study is voluntary. This is not something that you have to do. It's just a way for us to figure out if 5 days of antibiotics might be just as effective as 10 days. The information that you contribute would be completely confidential. We would not use Sarah's name. We just assign her a number, and your identity and everything about you is kept private.
Okay, what else do I need to know?
So we would schedule a follow-up appointment to see you. We would be able to give you the medicine at that time, and then we would also schedule to see you after she's completed the full course of medicine to make sure that the infection is gone. And we want to make sure that she is safe, and so we would give you a phone number so that you could reach us any time of day if you have any questions. So does this sound like something you would like to do with Sarah?
Yes, definitely.
Okay, so why don't you wait until Sarah gets home from school, talk to her about the study, because we want to make sure that she understands what's going on and that you're comfortable with it. You could also feel free to talk to Dr. Smith if you have any questions, or to see if he's comfortable with it also. We have a website that I can refer you to, so you could go online to see the information about the study. And certainly if you have any questions, you can call me back. But why don't we plan that you'll talk to Sarah when she gets home from school, and then I will contact you again tomorrow to discuss the study further.
Thank you so much, Dr. Martin.
Thanks so much. Bye-bye.